Real skin, real science, real confidence. With Dr. Zain Hussein. Welcome to
Skinside
Out.
Welcome to Skinside Out. I'm your host, Dr. Zain, with Heather and Courtney. So today we're going to be exploring the Fitzpatrick Skin Type Scale from the inside out. So let's get right into it. So the Fitzpatrick Skin Scale, what is it?
So it's a classification system that we use. It was termed or named after Dr. Thomas Fitzpatrick, who was a dermatologist. And this kind of creates a spectrum or a system that we use to classify how likely is someone to burn or get ultraviolet radiation.
Yeah. And I know that we often use it to kind of almost imply like skin tone. So that's not really what this, scale measures. So Courtney, what does it actually measure?
Yeah, I think there's a common misconception that when you're looking at different Fitz types, starting from type 1 to type 6, you're looking for the shade or tone of someone. So you might assume, someone who is pale like me is like a type 1 or 2, and someone with darker skin types, maybe your African American patients, are going to be closer to type 5 or 6. But really it is measuring how well you tan versus burn and what that exposure to UV looks like. So, it's funny. I think about one of our coworkers. She is Hispanic and she's very pale. And if you were just solely going off of shades, you might say, oh, she's a 2. Mm-hmm. But if you ask her, do you tan when you're exposed to the sun or do you burn? And that will give you the true intel on really what type she is. She'd actually be probably a 4.
So let's go into the actual 6 skin types on the Fitzpatrick scale, what they actually mean. So let's start off with Fitzpatrick Skin Type 1. I know that Courtney mentioned she might be classified as such. I'm not so sure about that.
I burn.
But you have a little bit of color to you.
Yeah.
So let's go into Skin Type 1.
Skin type 1 is skin that always burns and very rarely tans. You might also, like if you get a wound, it's going to turn red before it heals, whereas the darker skin types, or like Fitzpatrick's 4, 5, and 6, a wound might turn brown before it heals. So that's another way to kind of like help classify.
Yeah, and phenotypically, we see this in fairer individuals, light hair, light eyes, redheads especially are often classified as type 1, really blondes and blue-eyed individuals. They often fall into this category. Mm-hmm. Type 2.
Someone that usually burns, but they may tan like minimally. So I guess I'd probably fall into that.
Too.
And then type 3.
Type 3 is they sometimes burn, but they will kind of gradually fill in that tan.
Okay. 4.
Rarely burns and tans easily.
Type 5.
Skin that rarely burns and tans deeply.
And finally, type 6.
Almost never burns. They are deeply pigmented.
So I find that there is some utility to this scale, especially when we are using it as a general way to stratify risk, right? So skin cancer risk, laser safety, we often, think in skin types, sun sensitivity, and also other cosmetic treatments. However, it does have its limitations, right? So especially in a world that is becoming more multicultural, a lot more mixed, genotypes. So we're seeing a lot of, different ethnicities coming together. And even though a patient may look phenotypically like one skin type, their skin may behave biologically like another. And that's why it's really important to get a good history. I often ask patients about their ethnic backgrounds. And, especially if they have, some skin tones that I'm not entirely sure of. Like, you can't just assume because you do want your patients to be safe, especially with certain procedures.
Yeah.
Yeah, I think the issue with the Fitzpatrick's system is that it kind of went off of this idea of being a very like neat linear spectrum, and it's definitely not that case.
Yeah, and initially it was actually used to like do studies for photosensitivity and burning, so it really wasn't intended to be used for that purpose of classifying patients. So that's something that I always put in the back of my mind when I'm doing a history.
Yeah, during all of my laser hair consults, I will ask them, even regardless, I will just straight out say, like, what is your ethnicity? And it's so funny, sometimes people will throw out, like, I'm just white. And I'm like, I know, but, like, let's break that down. Like, what kind of white are you? Like, are you, like, Mediterranean?
Versus,
exactly. Like, there could be a wide variety.
Irish.
Scandinavian. So, like, there's a huge spectrum. And oftentimes patients also, self-report incorrectly.
Exactly. And that's, I'll ask them secondly, like out in the summer, like, do you find yourself burning easily, or do you find yourself tanning? And because sometimes, it's funny, like even with said coworker earlier, sometimes, on her skin type, historically, I will use a 1064 for laser hair removal, which is safe for all skin types. But we weren't getting where we wanted to be. We did a couple of test spots with the 755, which I would normally reserve for types 1, 2, maybe 3. And, we comfortably did it and it went fine. But yeah, that's why you really want to ask those questions before you get something like laser.
Yeah. Mm-hmm. And I have been fooled many a time, when seeing a patient, and I could be convinced they have this particular background, and it was completely different. Mm-hmm. And then I even know for myself, when patients look at me, sometimes they can't tell what I am. Mm-hmm. So, could I be, Middle Eastern? Could I be South Asian? I get Hispanic a lot. I get South American a lot. So, it's just hard to sometimes determine that. Mm-hmm. And it's really important to really just evaluate and talk to our patients prior to doing anything.
Mm-hmm. I think sometimes there's this societal issue still where, like, people want to not brag, but, like, be able to tan easily. And I feel like sometimes patients, like, if I'll ask them, like, do you tan easily? And I'm, like, pretty sure their answer is no, but then they say yes, and I'm like, like, and then that's when I typically ask the question about, like, when you get a wound, does it turn brown or does it turn red? And then they'll say red, and I'm like, okay, yeah, that's what I thought.
Yeah, I just think back of, like, my high school days where, like, all my friends would go out tanning, and my saving grace is really that I just burn so easily that I never would go out tanning.
I feel like people think that that's tanning, but you're just, like, burning
you're
to
burning.
The point where you're, like, showing a little bit of color change.
It's like when people say, oh, you have to get your base tan. I'm like, that's not real. Like,
And then that goes into the question, what is burning versus tanning, right? So tanning is, this reaction that your skin has. It's basically melanin that's already in your melanocytes being distributed, and that's usually a quicker process. A burn is actually when you have enough UV radiation damage to actually harm and damage the skin cells. That's why we see blisters. That's why we see peeling, erythema, redness. So it's a very different type of reaction. Mm-hmm. So how does this impact what we counsel our patients in terms of sun protection, and does it change anything?
I think it historically has. I mean, as we kind of touched on, the scale is being changed and reevaluated. I think it was very limiting, and I think people were using it more kind of, for that, like, toning or shade. You can't look at one person and say, oh, you're a type 4, so, like, you probably don't ever burn, and, like, let's just do this, or vice versa. So I think it held importance. I think we are learning that there are different factors that we can use to correctly, treat someone better.
Yeah.
And now there are, like, neuroclassification systems coming about that maybe more accurately depict these variances that we see between ethnicities and, how their skin behaves with sun exposure. So there are a variety of them that are being developed, some that are already in practice and use. And I feel like with more data, it's always probably more useful than kind of using, like, a generic kind of scale like the Fitzpatrick Skin Type Scale, which wasn't even intended to, classify patients based on their skin color. Mm-hmm. So I'm glad that that's out there now and people are thinking about that, because I think there will be a paradigm shift with how we will use that information for, our skin treatments.
Yeah, I think it's something that we will still keep in mind, and it will still be clinically practical, but it will be adding to it to make our clarifications more precise.
Yeah. And as we further understand the biology of skin cells, I feel like we will have more tools, especially with the advent of AI being so ubiquitous now. We may be able to use some of those algorithms and just analyze skin and kind of give some of those properties and characteristics once we have enough of that data. So I think that'd be cool.
Yeah, I think, yes, like touching on the data, I think, historically, I think one misconception, and even further than just the Fitzpatrick scale, but one misconception is if there's no data on something that it's inherently bad or inherently unsafe. And, I know we've talked about this a little bit with, recently, like Accutane and doing like laser hair removal on Accutane. Like some of the studies, I think it's interesting, like there might not be studies, and not because it's unsafe or we shouldn't do it, but just because it hasn't been studied. And especially when you look at like the history of our country and you think about like just the racial component, a lot of Black patients weren't really seen as patients, and specifically cosmetic patients, until the last 10, 15 years. And so a lot of this like early on research wasn't taking them into consideration. And so I think, there's definitely a lapse in some of like the research that we've had, and hopefully that also kind of continues to improve to include more, diversity.
Yeah, I've been really pleased to see more interest and advancement in skin of color in respects to dermatology. And, there are training programs where it's predominantly a Caucasian population. Sometimes those residents don't even see, pathology in darker skin types. So it's really important to be able to train our future physicians to understand that there's different presentations with different skin types, and it's really good that they're emphasizing a lot in education now. Do you feel like having another classification system is helpful, or should we not be looking at skin types in this way?
No, I think it is helpful. I think we should be looking at skin types in this way, but just thinking of it as like we can use that Fitzpatrick scale as a foundation, but there are lots of other things that are factored in to create this complete profile for a patient.
Yeah.
I was going to agree. I think we shouldn't limit. I think, the one thing about the Fitzpatrick scale to me has always been how limiting it is. Even just the fact of having 6. I mean, it's funny, like even when I think about people like my mom who, I'd put her at like a 3.5, and, I don't think the 6 is really quite enough to capture. I think you start putting people in these categories that doesn't accurately reflect, their true type.
Yeah. And I think eventually there'll be probably some like genetic testing, like genome sequencing, like of, skin cells to kind of really determine all these various characteristics that we see in skin, including, propensity to burn or skin tone, because they're two different things.
Yeah.
All right. So I think that this was a great discussion on, the Fitzpatrick skin types. It is something that we hear a lot about in the dermatology world, but also now, like on TikTok and YouTube, people are discussing skin types, and a lot of people don't know what they are.
People will ask. I get a lot of people that ask me.
Yeah.
And I'm like, I don't even want to go there.
Yeah. So it is helpful as a framework, but there are a lot of different factors regarding your skin health that we look into. And there's also different properties, right? So like we're looking at, oily combination or dry skin and other, various other characteristics. So I think that it is important to know this because I don't think it's going to disappear.
Yeah.
I think it's very well entrenched into our vocabulary and how we understand skin, but we also have to understand the limitations. And that will allow you to get a better picture of how to treat your skin and being safe.
Yeah, it's funny. I used to work with a dermatologist who, during all of her skin checks, she would type people, but she never asked those questions. Like, she would just tell us 2, 3, and like looking back, I'm like, I don't like that.
It's definitely becoming more personalized.
Yeah.
Yeah. All right. So that is the Fitzpatrick Skin Type Scale. I hope you enjoyed this episode. Please like, follow, ask any questions that you may have. But until next time, Skinside
Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717